Thank you very much, Sabrina. 826. About to get the medical director for public health, Dr. Janna Manglona, on the show, but I wanted to play this clip from Dr. Felix Cabrera from yesterday's press conference, and he was saying and discussing the criteria that would involve a move from PCOR to PCOR. So again, this is Dr. Felix Cabrera from the Governor's Physicians Advisory Council.
What we would look at additionally is, for example, the new cases itself. So we set an initial threshold of 5 cases in one day, but with the key part of that being a 5-day rolling average. So yes, 11 cases, it goes above that threshold, but it's important to look at it as a trend overall. So that's why, again, the 5-day rolling average is important. And in this case, it's only 2.2, so well below 5. If we see that it goes above 5 and it stays above 5 and it's trending above that, then that's one factor to take into consideration. The next part is the test positivity rate. And again, that's 3% is the threshold that we've been setting as a way to, if it goes above that, that will be a red flag. And in this case, from yesterday, it was 7.59, and the 5-day rolling average is 1.52%. So again, well below the 3% part. The other part is that it's important to understand that with this particular increase in number of cases, it's actually a good thing for an entire island that it's actually a cluster, or 10 out of the 11 is a cluster, because clusters are easier to study and control. And that's the key part. If this is 11 positives that are spread around the island, that's a whole different scenario. And that's when we may not even wait for our thresholds to be met before some other decisions have to be made. So that's the key part, I think, in this, in understanding what these 11 cases mean in context. So it's with that I would, that those 3 main factors is what we will look at before we raise even more red flags. But the key thing to understand again is, even with our histories, that what we showed was the positive cases were showing up to the hospital before we were finding them in the community. We're seeing none of that. So that's an added layer of assurance. The contact tracing team, in fact, the reason why we found these 11 positive is because of the excellent work they are doing, and they're going above and beyond. And also because we have more resources to test is why we're able to find this. So if anything, these positive cases are actually a positive thing overall, because we're finding them early, relatively speaking, compared to in the past. So we can get this under control in a much quicker and safer fashion, and rather than it can be a small little fire as opposed to a blaze, is what we would compare it to.
All right, so basically it's impossible to go back to PCOR1. Oh, man. Hey, let's, on that note, because I know she has a good sense of humor. Good morning, Dr. Manglona.
Good morning.
Well, it's Friday.
Okay, I'm done. Thanks.
How about them Raiders?
Yeah, how about them Raiders?
No.
49ers.
Redskins.
Yeah,
Redskins.
Right, yeah. Doc, just first of all, so we know that Linda discussed the cluster. Is there anything else that you can tell us about the progress that public health is making in tracking this group?
It's contained. In fact, I've got to be careful what I say, not because of public health or transparency. It's because we're small, and sometimes what we say pinpoints an exact person, and we've actually had a person even call and say, "Thanks a lot, now my family knows." And we thought we were being general, but it's small. And so when you say somebody that just got back from Barbados, there's probably one on island that just got back from Barbados, so that's the reason I'm careful. But I have to say, and of course I wear the public health hat, but if criticism is due, no problem, we'll take that. But I have to congratulate the contact tracers in this case, because there were, let me see here, did she mention this? I got to be careful I don't say overshare. There were 2 particular cases, and the information that we initially got was confined to the home, no, and I'm being real general. I wasn't involved in the conversation, but there was no big flag on the 2 cases if that's all that's in the household and they've been socially distancing and that sort of thing. Well, the contact tracers always want to be sure, so they made a visit, and they felt like they had better test everyone in that little area. And they did. They tested 25 people just to be cautious, and 10, no symptoms, did show positive. So, and it's only because they did that. Now they will take those 10, because we know that, gosh, how many contacts will an individual have? On a good day with no quarantine, 10 to 15 per person. Wow. So we might look at 150. And then what they will do, they keep going out. They start with the inner circle. They now identified 10. Then they expand it and go to each one of those. And where have you been? What have you done? And everyone in a certain band of the circle will be quarantined. So that's how you contain it. I'll see a lot of comments where they go, oh, it's already out there, forget contact tracing. This shows exactly how valuable it is. Even if these were spread all over Island, which would have been alarming, to say the least, we wouldn't have liked that. But these were all identified in an area that the flag was up. And so, and this is what they do with every case. And so it was contact tracing at its best. So now it's been contained, and they will continue and develop each one of those cases and quarantine as needed in the following days. So I don't know if that makes sense, but you don't want to see 11 cases at all.
Right.
But everyone's clamoring, going, oh, our machine doesn't work, we're never positive. This shows our machine does work. We've just done a great job as an island to do what we were supposed to do to stop this thing.
Right.
And now we're trying to balance the ship, ready for any wave that hits with incoming, that sort of thing.
Right, Doc, but how do you kind of balance not explaining away these 10 cases as a cluster? Because I mean, I'm not saying you are explaining it away, but
no, it's a cluster. Yeah. It's a cluster, and but it's gunshot from a gun can splatter, and you can have people hit with shrapnel all over the place, or you can have a little pocket where a gunman went in and shot the family, and so. If you have someone that has a motive and goes in and shoots the whole family and the whole compound, we could go on the radio and say, okay, guys, the whole island is not at risk. This was an identifiable person, and he had cause. So the whole island isn't at risk in general because of that one shooter. Whereas if you have someone just driving around shooting random, everybody better get in their houses and stay there. And that's probably not a good example, but if you this is sort of like that.
Yeah.
I don't know how better to say it.
But Doc, so obviously, I mean, there are people out there who are saying if we found a cluster of 10 asymptomatic COVID-19 positives, I mean, how many other ones are out there, right? That's what I think a lot of people are thinking that.
Well, we don't know, but that's why we do contact tracing, because we wouldn't have found these 10 without it. Actually, we had 11. One was from a different case.
Right. And
those were all identified because of contact tracing. If we didn't do that and followed what some people in the community are saying, oh, forget it. You've got 11 people out there with 10 to 15 contacts each, and then they're 10 to 15 each. I got to tell you, it is as important as quarantine. Guam is small. This isn't New York. We're not looking at 11 million people. We still have enough people to go out and look for the shooter.
So what would you say to people out there who are thinking that maybe this is a sign we need to just widen the testing criteria and catch more of these asymptomatic carriers?
We are, because we identified these as contacts. What about the ones we're not identifying as contacts? The ones where they haven't come to our attention, and maybe they passed them in a store or sat with them in a movie, or, I'm just throwing things out there. That's why we're expanding our testing. We're putting out a wide blanket across the island, and with plans to do congregate settings. Today we're doing the Gura public housing and elderly housing in Talafofo. We plan to do the high-risk individuals from congregate settings, temporary workforce, homeless on 4 days next week planned. I'll let the JIC report address that, but we've got 4 days planned to target the homeless, sheltered and unsheltered. Then we're going to go to we're leaving the frontliners for the last, fire department, police department, customs and quarantine, hospital workers and clinic workers. So we're doing just that, and we have so many test kits on island. So it's just great for us to have all these resources now. So there's not a shooter loose that we know of. By the way, too, it'll be interesting to see if these 10 or 11 are on the tail end of are they infectious? We don't know. Right. We'll know more as we check their contacts, because it could be that they didn't transmit it, because not everybody gets it. Out of the 25, only 10. So
and they were all within close contact. I know you can't say much, but yeah.
Oh, yes, I can. Okay. Very. Very. Okay. Yes, we know where the shooter is, and we know who he shot. so 15 of those people just sailed through and just yawned and moved on. The other 10 are yawning and moving on, but they now have a label. So,
and are they in the government of Guam ISO facility? The 10?
No, they're all where you live.
Oh, good. Nice.
Home quarantine, right?
I don't know where you live. No. You can breathe now.
Okay, who?
I couldn't say, but I don't think so.
Okay. Doc, have they squared up with you on your COVID differential pay? Just because you've talked about it before, the nurses, doctors within public health, have they paid you guys what you're owed?
Well, there are two categories. One's the differential pay for the hazardous pay. The other is the overtime, which was and then the third one, the double pay. And who knows about that one? The overtime is being addressed. The director has submitted all the papers, and there's been a little back and forth because they need this and they need that, because everything about this thing is new to everybody. And we were talking among ourselves the other day. We were hearing like, oh, this didn't get signed, that didn't get signed, that sort of thing. And the funny part, a funny analogy, is that all of our medicines, our drugs, and potential vaccines are all under that EUA, that emergency use authority that is only granted by the FDA during health emergencies. I think that our island is also working under an EUA, because imagine, oh my gosh, we've got 300 people. Imagine 2 months ago, we got 300 people coming in. What are we going to do? No time for contract, no whatever. And the governor says, do it. Here's an MOU, open the thing, get them in there. You do a lot under EUA not really under EUA. I'm just using that as an analogy. Right. You do what you got to do on the spot. Now you go back to when things are getting a little more quiet. We look back and we go, okay, how do we do? We go, oh my gosh, we let this ball drop. You start with your bag. Yeah. So, we're seeing things that had we had time to process it properly, those things wouldn't have happened. And I don't even know what I'm speaking of, but I just hear snippets here and there. And
I do.
I know. And I listened to your press conference yesterday, and I thought, he really likes those Redskins. See, I don't know all of that.
Right.
And I can't even comment on
right.
that.
Yeah, we're not asking you to.
Yeah. So, I hear those things, and I can see that there are little, where you sit and go, oops, that was an oops. Things that you wouldn't have done if you had plenty of time and you weren't working in a crisis in an emergency room. If you have time to sew someone up, the scar looks a lot prettier than in a crisis.
So it sounds like you guys are definitely going to be out in the community doing the testing, Doc. And
we are.
Today, right? Telephone?
Today, and then a tentative date, 26, 27, 28, 29, and Sunday. Different areas. And then the front lines, you will see a lot of that come as we move forward. But I want to go back one more time and emphasize, actually the shooter thing was not a bad example. If we thought we had a shooter loose on island, we would all run for the hills or run for the ocean. We don't. We have one shooter or two shooters with a motive, and so it's a good analogy. We don't all have to run for the hills. And actually, my question too is, did these people socially distance and wear masks? Because you got to know when you're in a compound or in a little area of group houses and everyone's feeling fine, that maybe barbecues happen. I don't know. But I have a feeling that perhaps there was a little bit of lapse in the following protocols. And we've all done it. I'll bet you when you all go to your back room, those masks come off. Everyone is, and I don't know that, but you take a little bit of risk when everything starts moving in the right direction. And so I'm wondering if maybe that happened a little. But the good news too, we have 11 cases that we identified. I wish it were still 0 and everyone's saying, oh, our testing doesn't work. I'd rather be in that scenario. But these people are fine. I mean, if they're spreading, they've been contained. They're not spreading now, even if they ever were. I mean, they may be on the tail end of their illness. Maybe they had it through 2 months ago, and now they just got the little crumbs. Was a good way that you put that, Chris.
Right.
Maybe it was just crumbs. We don't know, but you know what we do? The same thing we do if it's not crumbs. Lock it down, contain it. And thank God we're in Guam and we can do that. And I'll bet you would be hard-pressed to find any other country, island, jurisdiction who has done as well as Guam.
All right. Thank you so much, Doc. We'll let you get back to work and, cheering for your Raiders.
I just, Redskins. By the way, I just need another half an hour to tell you a little bit more.
Oh, you are so awesome.
Yeah.
I've answered your questions. Now I'm going to teach you some things.
All right, Doc.
Hey, as always, thanks for having me on.
Of course.
And if there's any question I can't answer, I will always get it to you, and I'll just text you the response.
Thank you.
Okay?
Thank you. Right on.
Thank you.
Thank you, Doc.
Sure.
Okay.
Bye now.
Wash your hands. There you go. Always a great time with Dr. Manglona.
All of them from public health, from
Good people.
From Francis to Rachel. I love having
To
them
Linda.
on. Yeah, man.
Okay.
Coming
8:44.
here so bright and cheery. This is a good time when they come
Okay,
on.
so we're going to get Mary Rhodes and Senator Sabina Perez on the show. Let's kick it up a notch. We'll take a little break first. 8:44. It's a KUAM News Takeover. Guam's favorite. Good morning.
Keeping you informed, KUAM News brings you Banking 671.